friends. It gives me immense pleasure to welcome all of you on this wonderful day at the 5th edition of the Health Innovation Summit and Awards. I am Kalpana Singhal, editor Tech Plus Media and your host for today. Allow me to set the tone for today's event, which has thought-provoking sessions, keynote addresses, and panel discussions to explore innovations in e-health, telemedicine, and technology implementation in healthcare organizations. These sessions will surely help us understand the future of healthcare under the current scenario and how IT can be leveraged for seamless healthcare delivery. The event will be concluded with an exciting evening of award ceremony to celebrate with our COVID tech warriors, best IT-enabled hospitals, along with most innovative health tech companies and healthcare solutions. It's a decade of cosmic transformation, and healthcare is no exception to this phenomenon. India, in fact, is a frontrunner in the adoption of digital health technology, with 76% of healthcare professionals in the country already using digital health records in their practices. This shows that India's healthcare industry is moving towards the digitization of their operations in a bid to improve the patient experience. The impact of COVID-19 has been a wake-up call for healthcare leaders, which are now embracing new and innovative technologies to operate in the post-COVID era and to ensure that they are prepared for similar unforeseen crises in the future. In the other words, the dependence on healthcare technological solutions will keep on increasing at a pace and scale we have not seen so far. This has numerous potential outcomes, from diagnosing illness at home to the customized care of patients post-release from hospitals and giving advice or reminders over video conferencing. Everything will change. With this note, let me invite Mr. Anuj Singhal, founder and MD Tech Plus Media, to deliver the welcome address and kickstart the 5th edition of Health Innovation Summit and Awards.
Good morning, good afternoon, or maybe good evening to some of you. A very warm welcome to you all at 5th Healthcare Innovation Summit and Awards 2020. The Indian healthcare system has notched up several significant achievements over the last 50 years, particularly in terms of life expectancy, infant mortality rate, and success in dealing with various diseases. In fact, technology in the last 2 decades has revolutionized the way the healthcare is being delivered in India. It has helped the patient and the provider by enhancing the quality of the delivery, reducing in the turnaround time of the workflow, and thus reducing the overall cost, besides bringing the higher accountability into the system. Perhaps now more than any other time in our history, during the tough phase of COVID-19 pandemic, we are realizing the importance of technology in the healthcare delivery. The COVID-19 pandemic indeed shaking up well-established business model and dispelling long-held assumption, holding out an opportunity to reshape and democratize healthcare around the world. Technology has played a very important role in this transition. This transition is further bolstered as India emerged as one of the fastest growing digital economy over the last few years, characterized by a 90% growth in terms of the technology adoption index. The robust digital footprint of India, coupled with government supportive policies, has played an instrumental role in driving the growth of digital healthcare market. The digital healthcare market in India has valued close to 11,661 crores in 2018 and is estimated to reach 48,443 crores by 2024, expanding at a CAGR of 27.41% during 2019 and 2024. Despite its shortcomings, including inadequate access, low insurance penetration, and growing chronic disease burden, India's healthcare sector has a lot going for it on several fronts. The availability of telecom bandwidth is making the medical expertise reach underserved rural market through telemedicine and teleconsulting program. Government-led push to get healthcare providers to embrace the electronic records and enabling artificial intelligence to extract insight from patient data to deliver better treatment. On the other hand, the Digital India program, initiated in 2015, has strengthened the digital infrastructure required in the healthcare industry. With the launch of Ayushman Bharat program in 2018, Indian healthcare industry has seen a phenomenal growth. More recently, the government has announced the National Digital Health Mission, which is NDHM, to create a national digital health ecosystem which provide a timely and efficient access to the inclusive, affordable and safe healthcare to all citizens. The NDHM comprises 6 key building blocks, namely Health ID, DigiDoctor, Health Facility Registry, Personal Health Record, e-pharmacy and Telemedicine. While the core building blocks of NDHM such as Health ID and DigiDoctor and Health Facility Registry shall be owned and operated by the Government of India, private stakeholders will have an equal opportunity to integrate with these building blocks and create their own product for the market. The additional components like personal health records and electronic medical records solutions will be developed by the private healthcare players in India. Apparently, the government is also providing adequate push for the healthcare technology to improve the critical process that today pose a big challenge in the delivery of the quality healthcare. These include reaching millions who are geographically spread across the country, providing better and a more accurate diagnosis, managing operations and facilitating effective collaboration and dialogue between doctors and healthcare workers. The convergence of technological solution with data analytics, cloud computing, telecommunication, and wireless technology will improve the accessibility and manage skill storage more efficiently in the healthcare industry. As technology innovation better integrates with healthcare delivery, it will enable the scale and lower the cost, driving up the adoption. And the adoption will further driven by the automation of critical process at hospital in administration, finance, billing, pharmacy, and patient recording experience. As the future calls for a new approach to prevention, screening, diagnosis, therapy, monitoring, and management of disease, technology will become more crucial than ever. Thank you.
Thanks, Anuj, for your deep insights on the health technology landscape and how is it going to shape up in near future. We are delighted to invite Ms. Sangeeta Reddy, a global healthcare leader, entrepreneur, and joint managing director of Apollo Hospitals Group, to deliver her guest address. At the helm of Asia's largest healthcare group, Ms. Sangeeta spearheads the organization's endeavors in the domain of telemedicine, e-health, and mobile health, and continues to head the IT functions across all divisions of the group. She is also credited for creating an IT-enabled patient-centric operation across the Apollo footprint. Instrumental in growing the group's retail healthcare foray, she leads the Apollo Health and Lifestyle portfolio, which includes clinics, cradles, and other retail service formats. In addition, she is a member of the prestigious World Economic Forum Global Agenda Council on Digital Health, which aims to advance the use, adoption, and measurement of technology in healthcare with focus on digital health. She is the current FICCI president and an ardent champion advocating the benefits of a global delivery model through rural hospitals, outreach camps, telemedicine, and other such innovative models. Sangeeta has always focused on the need to create healthcare of the future.
One of the significant aspects which is transforming the way healthcare delivered is the use of technology in care. And whether we're talking about the electronic health record, which is one of the major projects that FICCI is recommending to the government, that we should have a universal health record. This should be linked to the UHID. This in fact is an algorithm which was developed by TCS and Apollo and donated into the public domain so that everybody can have a common numbering system. From that, the benefit to patients would be that irrespective of which doctor they go to, they can have access to their record. This will enable a continuum of care. This will also be linked or can be linked to devices. So whether they're wearing a Fitbit and they want to track their number of steps, or we're moving on to an acute patient who's linked to a cardiac monitoring and you want this to happen at home. All these are enabling underlying technologies that need to be integrated for a more evolved healthcare system which uses technology appropriately. I think there's a great need to have a universal health portal where patients can just log in and find which is the hospital closest to them, what facilities do they have, and which insurance coverage. So are they empowered to go into that hospital? Imagine for an Arogyasri patient, how would they find out where they're supposed to go, or for an Ayushman Bharat patient? So there's a range of technologies which are evolving, which the country would be very much benefited by creating. And I think the time has come now to also find ways to manufacture technologies in India so that the cost comes down. Because right now, every new hospital spends a tremendous amount of money and almost 17% of their budget annually on replenishment of new equipment and technology. So people who are talking about bringing down the cost of healthcare must clearly understand that one of the biggest input costs, the first, of course, is the cost of the manpower. But the second large input cost is the cost of materials and the cost of the large equipment which is used in hospitals. Unless we find ways to bring down that cost, it is very difficult to bring down the cost of care any further. What is more important is to find mechanisms to enable, like insurance, which enable us to defray this cost of care across the population and not just on the family who has someone who is ill. The next important aspect is to focus on preventive healthcare so that people do not get extremely sick, or the number of people who get sick comes down and the overall burden of disease in the population is reduced. This can happen like we have done in our village in Aragonda in a project called Total Health. You first focus on the social determinants of health, which is clean drinking water, sanitation and nutrition. By taking care of just these three, you will significantly reduce the incidence of disease. Then you move on to the provisioning of care and screening and early detection, and the biggest burden, which is NCDs or non-communicable disease, find ways to screen, to monitor and keep under control the non-communicable disease, whether it's blood pressure or diabetes or obesity. These three single factors are contributing to the largest number of advanced surgeries which are happening because of these uncontrolled conditions. So an overall holistic view to care, a proactive intervention at the right time, an ability to share the skills and the resources available across the ecosystem at the point of care using technology, and finally artificial intelligence to enhance and enable doctors to handle more and more complex situations. All these are things which will happen in the future of healthcare, and we look forward to this, making India healthier and happier.
Thanks, Ms. Reddy, for an inspiring and thought-provoking session. Now we have with us Dr. Praveen Gedam, Additional CEO, National Health Authority, to have a fireside chat with our founder, Anant Singhal. Dr. Praveen is an IAS officer of 2002 batch and now is responsible for supervision and coordination among the ministries, state governments and other stakeholders in implementing Pradhan Mantri Jan Arogya Yojana and National Digital Health Mission. He has held several important positions as a career bureaucrat, and prior joining to NHA, he was the private secretary to Honorable Minister of Railways and Coal. A go-getter by nature, Dr. Gedam has led institutions to their optimum level. Before joining Government of India, he served the Government of Maharashtra in various capacities. He was Transport Commissioner of Maharashtra, where he spearheaded a massive computerization exercise involving all 50 offices under him and ensured computerization of database of more than 27 million vehicles and 30 million driving license holders of the state. He is known for the turnaround in maternal and child health indicators in Latur, one of the most backward districts of Maharashtra, due to targeted interventions, systematic medical checkups, and massive community mobilization exercises. From 2006 to 2009, his 3-year mission led to a considerable increase in deliveries at hospitals, which went up from 48% to 93%. There was also a fourfold reduction in the number of cases of severe malnutrition in children and a drive for medical checkup of 1,62,000 school children. He has also tied up with UNICEF to prepare micro plans to ensure the long term sustainability of these initiatives.
Hi, welcome to the Fireside Chat. My name is Anuj Singhal. I'm the founder and editor in chief of Health Technology, a community under CXO TV, a web channel from Tech Plus Media Group. So today we have with us Dr. Praveen Gadam, who's the additional CEO, which is for the National Health Authority, which is the Government of India, as our guest to talk about the launch of NDHM, which is the National Digital Health Mission to improve the efficiency, effectiveness, and transparency of health service delivery ecosystem in India. So let me give you a brief introduction on Dr. Praveen. So Dr. Praveen has done an MBBS. He is an additional CEO of National Health Authority of India in the rank of Joint Secretary to the Government of India. He is an IS officer of 2002 batch, Maharashtra cadre. As the second in command at NHA, he assists the CEO in his functioning. Welcome, Dr. Praveen Gadam.
Thank you, Mr. Anuj, and many thanks for having me here. Many thanks to Health Technologies of Tech Plus Media Group.
Thank you, Dr. Praveen. So, on the occasion of Independence Day, we saw our Honorable Prime Minister Shri Narendra Bhai Modi made a historic, announcement on NDHM, where NDHM is expected to bring revolution in the healthcare sector. Uh, every Indian citizen will get a health ID, which will be a repository of all health related information. So out here, I think technology will going to play a very critical role in minimizing the challenges citizens face while seeking the healthcare. So with this, Dr. Praveen, I expect you to just elaborate a little bit and talk in detail about NDHM in terms of your mission, your vision, and how you plan to roll this out, and how it will going to make a change in the current healthcare delivery ecosystem in India.
What? See, NDHM comes from the National Digital Health Blueprint, which was released last year by the Government of India, and in which a lot of brainstorming and opinions of experts in the field has gone. So it is basically creating a new digital platform which will enable much more efficient delivery of healthcare across all healthcare facilities with the help of all healthcare professionals in India. Basically, it shall consist of three fundamental modules, three fundamental registries. One which you mentioned is Health ID, which will be unique and will be every individual shall be entitled to get one such Health ID, and he can get it very easily in less than 1 minute by logging into our website. Then there are other two fundamental modules, one pertaining to doctors and other pertaining to facilities, that is hospitals, clinics, laboratories and all that. And everything
Okay.
will be linked together. So this is a digital platform in which all the health related information gets populated, and it can be used subject to certain regulations with while due precautions of security and privacy are also taken care. And most important thing, joining this is a voluntary and it's not a mandatory kind of process.
So, in the absence of the data protection law, how your existing data management policies and standard will help to guard patient information and their privacy? And what are the measures you are taking for data security?
Till any law is passed by the parliament, judgments of Supreme Court have effect of law. So we already have Katinov judgments, the most famous being Puttaswamy judgment, which has laid out principles of security and privacy, particularly in the digital world. Second
Mm-hmm.
point, there is no law which has been passed by the Parliament. There is a Personal Data Protection Bill 2019, which is already under consideration in the Parliament and which we expect to be passed very soon. So if you see
Uh-huh.
that there is an existing legal framework which allows us and which guides us in our mission forward, and we have considered all these existing legal provisions and also legal provisions of forthcoming PDP bill, and we have
Mm-hmm.
designed the products based on these legal principles pertaining to
Mm-hmm.
security and privacy. And I want to assure the citizens of India through you that utmost precautions, I have talked about legal precautions, but utmost precautions of technological side also has been taken. India is known as IT superpower of the world, and we are here to leverage that power to ensure that the data, which is of very sensitive nature, must remain confidential, private, and the citizen should have that comfort. Yes, whenever I am uploading this particular health record of mine, it is visible or accessible only to me and only to those whom I am giving permission or a consent.
And do you have any plans to integrate telemedicine with this? Any timeline being planned on this?
Absolutely. See, telemedicine is one of the main modules which we are envisaging to get joined with the three modules that I just discussed. The other modules being
Okay.
health records and electronic medical records and so on and so forth.
Uh-huh.
By this platform, we will have all the health facilities and doctors and specialists which shall be available at the click of the button to individual, and then he shall be in a position to make choice. Doctors and hospitals
Okay.
have an advantage that they shall be able to display their name on the digital platform and make themselves available. So it's a win-win situation. And once
Mm-hmm.
the telemedicine consultation starts, the doctor will have
Mm-hmm.
advantage of accessing all the health records of the individual, which may not be pertaining to his hospital also. It can be from even the doctor from hospital A is doing teleconsultation. He can
Okay.
access records with Dr. B, Hospital C, Laboratory D, and then he
Mm-hmm.
can make his decision properly. So this is a very big leap forward that India is going to take once this telemedicine module goes live.
So what we can see is that when Aadhaar is already there, so why so many IDs? So any point on that?
Yes. See, the reason is legal rather than technological. Technically, even if it is feasible to attach or link various records to Aadhaar, law doesn't allow that. Uh,
Mm-hmm.
Law doesn't allow use of Aadhaar number for doing this kind of exercise, and
Okay.
it has its own use, and particularly it can be made mandatory only when there is a government subsidy scheme
Okay.
in which some element is going to an individual. Only then we can say that okay, to entitle this benefit you have to have Aadhaar. This is altogether a different kind of use case, and that's why we have come out with this health ID concept. But
Mm-hmm.
health ID can be linked with can be generated using Aadhaar number, and I
Mm-hmm.
understand difficulty the people keep facing for remembering so many numbers. So if
Mm-hmm.
you are using Aadhaar to generate health ID, you can
Mm-hmm.
enter Aadhaar number to log into the system. It's
Okay.
not the case you have to remember all the IDs separately. But in case you don't want to link your Aadhaar with health ID, then you will have an option of remembering health ID, or even create an alias, Mr. XYZ at NDHM, so that it
Uh-huh.
becomes more easier to remember. So we are giving all the options to
Mm-hmm.
individuals.
What are your plans when it comes to use of this data? Is it that this data will going to be used by NHM, or is it that it will be used by the other healthcare government agencies?
Okay, I'll tell it in three broad areas. The most important use obviously is to the patient or individual himself and the doctor who is treating him or a consulting
Okay.
physician. So they will use it the way I
Mm-hmm.
have explained to provide do the proper diagnosis and provide proper treatment. It will save a lot of money also, because repetition of tests, repetition of examinations will also be avoided. Second use will it will be possible to use this for better research, development, and public policy. So I repeat, I start with the point that individual information will not be made available to anybody, but to certain authorities. For example, a specific department of government, let us say health department of government of Delhi, will be able to see how many cases of COVID are increasing in various parts of Delhi over the period of time, so that efficient healthcare intervention can be given, and situation or the next pandemic can be avoided. So these kind of larger issues of larger public interest will be taken care of only after what is known as anonymization. So it is not the case that government will be able to see what is being happening to XYZ. It's not the case. They will be able to see that in the New Delhi district, 100 cases were there yesterday. Today the number is 120, and that is anonymized statistics which can be used. And the third and very important point: this shall be done only subject to certain rules and regulations, which shall come in place with very strict protocols and by only certain authorities. It is not going to be used for any commercial reason. We do not are not going to allow this to be used by any commercial firm or company for making profit, or anything to do indirectly to any business interest. So insurance company, for example, won't be in a position to use this data to develop their business model or to decide the premium. So that kind of we are not going to allow. And what kind of use we are allowing is happening even right now also. Even now the government is, for example, compiling the number of cases of COVID in various parts of India. That will only be facilitated through digital platform. It will be real time and more efficient way.
So my last question, so when it comes to the implementation, we have seen that initially, this has been implemented in few of the union territories, and now I guess subsequently it will be taken to different state. So what kind of a thresholds you have, when it comes to rolling out this particular plan is concerned? Is it by 2025 you plan to, reach out to say X number or Y number? If you can elaborate a little bit on that.
I see it happening much before that. See, we have rolled out on pilot basis in 6 union territories of Ladakh, Chandigarh, Dadra Nagar Haveli, Daman Diu, Puducherry, Andaman Nicobar, and Lakshadweep. And I'm happy to share that in a couple of days only we have crossed almost 12,000 health IDs, and see the advantages of this system will be so much that I see all the individuals, doctors and hospitals joining as soon as possible, and the ecosystem getting developed much before what you just said, 2025. But obviously it is not clearly possible to predict the exact numbers, because there are too many variables and dependencies. But definitely not 5 years. It should happen much earlier, and we should be now leapfrogging, because we already are a digitally enabled nation. We are a digital India, and I see this platform of JAM, Jandan Aadhaar Mobile, and the deep penetration that we have right now of this trinity, enabling us to sort of leapfrog into this particular mission.
So with this, Dr. Praveen, I'll just thank you, for your valuable time. You shared your thoughts around it. That was too important for the industry. Thank you so much, for being there.
Thanks, Dr. Praveen, for your valuable insights on the current healthcare developments and apprising us on the government's initiative to boost healthcare delivery. Now it's time for an interesting panel discussion on telehealth in the new normal till we make arrangements. Please watch a video from our sponsor, Treat Well. Thank you.
An extremely demanding and operationally complex place with very little room for error. But did you know that almost 30 to 40% of your staff's time is wasted in doing non-core jobs? And untracked operations often result in confusion and delays. Result? Chaos, low productivity, demotivated teams, and poor patient experience. Presenting TreatWell, a platform to help you deliver outstanding service every time. It tracks every request because what gets tracked gets better. With super intuitive UI, it allows communication via multiple interfaces: Google Home, Alexa, tablets, smartphones, desktops, SMS, and intercom. With such simplicity, improved productivity and control over operations is only natural. TreatWell also enables process re-engineering by providing detailed insights about operations and staff performance, and gives actionable inputs for operational teams. Apart from improving the bottom line, TreatWell also opens up additional revenue opportunities by automatically soliciting the right service at the right moment. All of this with a clear focus on improving the patient experience. And that's not all. TreatWell comes with the integrated real-time feedback management, such that service recovery happens before the patient is discharged, and help improve your Google rating. Working with some of the largest hospitals, TreatWell, things get done. In time, every time.
While the healthcare industry works to fit telemedicine into existing business models, entrepreneurs and forward-thinking health systems are creating new models, including direct-to-consumer services. Organizations that have begun the transition to value-based payment along with non-traditional providers see telemedicine as a way to disrupt the competition. This panel will explore ways that provider organizations are using telemedicine to create a more patient-centric experience and adapting to a value-based world, and examine ways that companies are creating direct-to-consumer experiences. Let's hear from a panel of expert speakers with real-world examples of how organizations have used telehealth to enhance the human connection and drive value. Let's welcome our renowned panelists to take this discussion ahead. Please welcome Mr. Bharat Gera, Project Lead Alliance for Telemedicine Registry and Evaluation, Mr. Girish Kulkarni, Chairperson Chime India Chapter and Board Member of HIMSS India, Dr. Vivek Sahi, Board Member HIMSS India, Mr. Girish Koper, GMIT, Wockhardt Hospital.
Good afternoon, ladies and gentlemen. Welcome to this elite panel on the telemedicine and its impact on the healthcare processes and the healthcare delivery in India over the last couple of months, and how is it going to shape and how is it going to pan out over the next couple of years from a provider perspective, very specifically. My name is Girish Kulkarni and I'm going to be the moderator for this panel today. I'm basically a health IT CIO, worked with multiple healthcare providers across the country. I'm also the chairperson for the Board of Trustees for Chime in India. I am also the joint secretary for the CIO Club as a part of the governing body, and I'm based out of Bangalore. Currently working with multiple initiatives from a hospital provider's perspective, working with a few startups in terms of mentoring them in their businesses. And yeah, whenever I have time, get to catch up with the elite company like my co-panelists to get their views, get their thoughts, and also to share experiences of how and what they have been doing in their businesses. This is a quick brief about myself. May I request my co-panelists, Dr. Vivek Sahi, Mr. Bharat Gera, and Mr. Girish Kopar to quickly introduce themselves to the audience, and then let's get going on this. Over to you, Doctor.
Thank you, Girish. Good afternoon, everyone. My name is Dr. Vivek Sahi. I am a clinician by profession and training. I also possess a master's degree in hospital management. I have been working in healthcare IT for the last 14 plus years now, and I've done various projects across various different continents, spanning the length and breadth of healthcare linked to information technology. At the moment, I currently also work with startups. I'm currently working with one particular startup at this point of time. And I also am on the board of HIMSS India, and I'm leading the HIMSS India Telemedicine Committee. Thank you, and over to you, Bharat.
Thanks, Dr. Vivek. Bharat Gera, my last assignment was as the General Manager IT at St. John's Medical College. And earlier to that, I've been in healthcare for 2 decades, been working with several hospitals. Also spent about a decade working in the United States with various companies that's related to healthcare. Now, in the last year, I've been focusing on how to work together with the healthcare ecosystem. I've been working in different capacities as a volunteer with the DH India, as well as with Telemedicine Society of India and the Step One project. During the COVID times, I've been spending a lot of time as a volunteer. It's been a great experience. Looking forward to the discussion. Thank you.
Yeah, hi. Good afternoon, everyone. One is thanks Anuj and team for this opportunity. Myself, Girish Kopar, having experience of more than a decade in this healthcare IT. Currently, I have the IT for Workard Hospital Limited. Also, I am on the board of Chime India and hence as a committee member, and look forward to it.
Fantastic. My pleasure to interact with each one of you and to welcome each one of you onto this elite panel. Quick start to this. We have had a major set of changes which have happened, and a lot of initiatives which otherwise would have taken its own time to get done have been hastened through, and we've now seen that. The first step was the opening of the telemedicine practices, which was done by the Government of India, Ministry of Health and Family Welfare on the 25th of March. And that really opened a tremendous amount of opportunity. And each one of us have been in various capacities associated with this movement. The other major step which we've taken a couple of days back is when the Honorable Prime Minister has announced the National Digital Health policy, and that's going to be a definite game changer in my opinion. However, today we would focus primarily on the telemedicine part of it and speak about it for the benefit of all our audience and our delegates on these sessions. And we're going to be very particular about trying to be within the framework of telemedicine. Let's not dwell too much as a group outside that. Is something which I would request, though each one of you would have been associated with the other set of programs and policies which the government has initiated. Right now, to begin with, this is one question I would want to start with each one of you. We could take the lead and then go in a sequence here. And my question to you all is, the pandemic actually opened the Pandora's box and opened a lot of opportunities. Some people say it's the good, the bad, and the ugly, which has happened to healthcare industry and to healthcare providers, not just in India but globally. So in this situation, how do you each one of you see the evolution of digital health, which was probably about 4 or 5 years old in the healthcare businesses, actually leapfrogging and then moving in a very fast pace over the next 1, 2, and 3 years?
Right.
Dr. Sahi?
Okay, so thanks, Girish. A very interesting question that you've put across. It's interesting to note, that you've said, the pandemic has opened up Pandora's box. Yes, of course it has. However, if I look back in time, and if we look back at digital healthcare in general, okay, I would say that it has been around for quite some time. It's not something that is 2 or 3 years old. It has been there for I would say at least for the last 16, 17 years, if not more, in India at this point. Of course, it started off with digitization of the billing piece for healthcare providers, then went on to registration, and then supply chain, and so on and so forth for providers and in hospitals. So if we are saying that COVID has hastened it, I would not say it has hastened it in its entirety. I would say certain aspects of digital health have fast-tracked, let me put it that way, ever since the pandemic opened. If we now talk specifically about telemedicine as an example, telemedicine, again, as all of you are aware, has been around for quite a long time. I can cite instances of telemedicine that have been happening since the 80s, maybe not in India, but in other countries. But if we talk about India, it's been around for quite some time. There have been people practicing it in some form or the other, and it had been a very, very, very fragmented practice in the past. With the commencement of the pandemic and everything that it has brought to it, and the conditions with regards to social distancing and protection, it is something that the providers have realized that it's more of a necessity than something that they want to do, and they had no choice but to accept it and transform to it and start using it. And that is what has led to, depending upon which reports you read, across the globe in the last 6 months, teleconsults have gone up by 500 to 600%, which is phenomenal. Although it's not a nice thing to say, but those of us who are working in the telemedicine space and even in the digital health space have to give credit to the virus.
Got you.
If humans don't want to adapt to change, then they'll be forced to adapt to it, and that's exactly what the virus has done for us.
Right. So where do you see us heading over the next, let's say, 1 or 2 years on the digital space?
I think it's only a matter of time when we catch up with our counterparts in the West. With the Prime Minister on the 15th of August announcing, the National Digital Initiative, that means that the government is very, very serious about doing this now, as opposed to just talk. Now they really want to do something. Having a unique ID for each Indian citizen, healthcare ID for each citizen in this country is going to be a huge task. However, we have seen in the past the governments have managed to do Aadhaar, and according to me, in my opinion, I think they've done a pretty decent job about it. So I think if they've already proved once that they can do it with something like Aadhaar, I'm sure that they can do it with giving a unique health ID to all its citizens in India. Over and above that, what telehealth has also done is it's opened up other areas where government and government agencies have been dragging their feet. One example I would like to say is e-prescribing. Okay, the commencement of that is through the implementation of the telemedicine guidelines by the government, which we will come more into more detail, discuss in more detail during this discussion. But it has opened up other avenues where now the government has realized that they need to come out with frameworks, policies, and guidelines and regulations to push this forward if they want to achieve this. So I see a lot of good things happening in the next 2 to 3 years where healthcare digitization is concerned for health.
Thanks, Dr. Vivek. Girish, your opinion on this?
Yeah, let me come from the provider point of view. As you rightly mentioned, this has triggered the Pandora's box. Now, let us see from the provider's point of view what has changed after this pandemic. One is how have the hospital got impacted. The first point is loss of revenue because there is no footfalls for OPD, and the patient engagement or the patient connect is missing because the patients who had taken consultations, undergone surgeries, want to connect to the hospitals, connect to the doctor. That is not happening. And as Dr. Vivek was mentioning, telemedicine was always there around, but it was a good feature to have. So if it was more of a matter of choice for the hospital, so if it is a choice, obviously people will take the easier route by not adopting it. So that was what was previous to that. Now, who is the savior? So because there are no OPD footfalls, then the management, the hospital has to rely on something, and that is where technologies come as a savior. It can be as crude as using a simple Zoom meeting for your teleconsult. Basically, the whole objective is to have customer engagement, to keep the customer engaged, to acquire new customers, and to continuously educate. So this has changed a lot of things, and now this not only has changed in the B2B segments in hospitals, because if you even go to your local GP at the beginning of the pandemic, he would say he would send you a link on Zoom and said, okay, you make a payment here and then we can do a consultation. So this has not only changed at a B2B level, but the technology adoption is now by force. I would say it would be the new normal. And one more thing I would like to clarify, which people get confused, is teleconsultation and telemedicine. Teleconsultation is the first step towards telemedicine, where you start engaging the patient with a telecall, a video call, then go to your IoT devices, you connect, and then move on to teleconsultation. Because telemedicine requires a lot of investment, whereas teleconsultation, which is the first step, it starts with minimum investment. And the other thing, what has happened is a lot of startups have mushroomed, and they are willing to cater you as you want, which was not there. So you can even dictate the startups who are okay. You can demand from the startups. So this is what is the current scenario post-pandemic. As rightly said, this triggered the Pandora's box. That's what I would start this conversation.
Thanks, Girish, for your thoughts. But Bharat, before I move to you specifically around this point, having heard the arguments both Dr. Vivek and Girish, it is imperative we also have to think and worry about the standards and the protocols, right? Standards could be in terms of definition of your processes, definition of how you're going to build your technology stack, how are you going to implement, and how are you going to deliver services, right? So what's your take on the standards, and how do you see the standards actually evolving and making this happen easily, seamlessly, and I would say available to every single citizen through every single provider?
Right. So let me start from the beginning of the COVID response. So the first response for COVID came from an organization called Step One. And what was essential in this context was the entire triaging at scale. We had a lot of calls coming in, more than 20,000 calls a day coming in, which the COVID control center in Karnataka was just not able to handle. And there was a deluge of calls, people worried about their health. And the response of teleconsultation, as Girish rightly put across, was that you do an immediate consultation on the phone using a simple IVR service. While I was doing this triage with the Step One team and looking at the data that was coming in, it was becoming apparent that there were about 5,000 doctors on the platform. handling the calls. And there were inconsistencies amongst the doctors. Each doctor seemed to take the call in their own way in terms of triaging, although there was a well-defined methodology by SCMR, but there were differences in the way each doctor went about taking the call. While we were doing that project, the telemedicine practice guidelines were issued. That made it much clearer in terms of March 25th, the guidelines were issued. And then it was a little bit clearer, at least at a very principal level, what are the basics that need to be in place for a teleconsultation to take place. That you need to disclose the name of the doctor who's consulting, you need to disclose the patient's name, you need to make sure that there are some privacy safeguards in place, security and safe data is not being taken away. A lot of other interaction capabilities. What can you do during the consultation? Which drugs you can prescribe? What kind of consultations you can do and you cannot do? The telemedicine practice guidelines brought that out in March 25th. Now, at that time, I was working as a volunteer with the Telemedicine Society of India, and they came up with a wonderful response. And they said, we're going to go out there and train all the doctors on how to use these guidelines, because the guidelines were published, but it's like a 50-page document. And how do you expect every doctor to know how to use those guidelines? So they set up some really good 2-hour training programs, which were then propagated across the country. And that gave people the basics of how to do a teleconsultation. But again, there were a lot of calls. There were people who said, can I do chemotherapy at home? There were people saying, can I do a consultation for a patient who's abroad? And still there was a lot of lack of clarity in terms of what could be done and what could not be done, because the practice guidelines gave the principles of teleconsultation or telemedicine, but did not lay down very specific terms and conditions at the protocols that need to be followed. At this point, we started a project from DH India where we said we will look at, because it largely boils down, if you really look at it, a lot of the protocol implementation or the privacy implementation is dependent on the platforms you use. And we said, let us look at these platforms and see whether they conform to the standards that need to be achieved for a telemedicine provider. So let's say you're a hospital or a doctor and you're providing telemedicine. What is the difference between you doing it on a WhatsApp call versus doing it on a platform which engages and gets the consent for you? So we then looked at these platforms, and what we did was we evaluated them against the standards set in the telemedicine practice guidelines, and we also evaluated them on the privacy and the security and the conformance to interoperability. Now, all these things definitely play a role in ensuring a standard. Technology interoperability, technology consent frameworks, all this play a big role. And as we've seen over the last 6-8 weeks, India has made rapid progress in putting in place a digital public health infrastructure, which promises to solve these problems very, very elegantly. And we've just started on that journey. About your question of how these standards need to be further amplified and further elaborated, I think you're right. Wherever telemedicine has been put in place, there has been a certain drop in the clinical outcomes because the doctor is not used to it, the patient is not used to it. It's a convenience thing, but it does not necessarily a better way to get a good health outcome. So how to do that requires a way of designing protocols. And I understand that there are organizations, including NABH and another organization associated with Telemedicine Society of India, which are working on this area. So a lot of promise ahead, a lot of difficulties which need to be addressed, which require the putting down the standards and protocols in place. Thank you.
Fantastic. Fantastic and very insightful, Bharat. I would want to follow up with a very quick question on your opinion on this, which is what do you think are the security challenges which will be something which is associated with an initiative like this?
Okay, so I would say security is two parts, right? One is the privacy part and the other is the security of data part, right? Now, if you were to look at privacy, it is like largely about the individual's privacy, and I would say even the doctor's privacy. While doing anything digital, there's always a fear that you will lose your privacy. That is a separate thing. That requires a consent framework, which I believe is being addressed. But another aspect which you rightly pointed out, for which I not seen much being done so far, you might be more aware as you're interacting with the digital council, but what I've noticed is that it's literally a Pandora's box there, because the IoT devices that we're going to use for remote patient monitoring are fraught with a lot of dangers. These devices were never designed to be used for a legitimate legal process. They were meant to be convenience devices for self-care. Now suddenly we've got them on platform.
Bharat, sorry to interrupt, Bharat. So when you say dangerous, are you here referring to vulnerabilities which can be exposed, or which are exposed?
Yes, vulnerability which are exposed. So one is if you use one of these, if they don't have proper access controls, it literally means the device that you're connecting to can be viewed by anybody else who can hack into your device. Now, depending on the importance of the person, they could use that hacking for very, very nasty purposes. So that is a big danger. There could be showstopper kind of denial of service attacks at a very large scale if you were to deploy these IoT devices for a large population. I think we're not prepared in India, definitely. I've come across a few Israeli companies who have been working on the Internet of Medical Things and the security involved in those areas. But in India, we have to put those safeguards in place. Otherwise, we are risking a lot of things by opening up these devices that have not been tested from a security point of view, especially for healthcare providers. They can literally be used to hack into their entire networks. So we have to be very careful, and there could be some bad players, nasty players in this whole game. As we've seen, there are geopolitics involved, so we have to be very, very careful about how we put in these, whether it's a video conferencing platform or an IoT device. We have to be very sure that these devices and these video conferencing platforms are tested for the security protocols.
Thank you. Thanks, Bharat. Moving on, we probably I see some questions from the audience, but I think we would look at the audience questions once we're through with our conversation, and we would pick, if not all of them, at least definitely some of those important ones, and then get each one of you to address that. I now move back to Dr. Vivek. Doctor, telemedicine, which is virtual care, has opened up innumerable number of opportunities. Where do you think are the newer opportunities which have been already explored, where people are working on it? And in your opinion, where do you think the opportunities still lie and exist, which needs to be opened up, harnessed, and utilized?
Okay, interesting question, and a very pertinent question, in fact. If we look at the journey of telemedicine, I would say it has its roots in specialties. As one example, when it started in its early days, it had its roots in specialties, let's say for example psychiatry, where a lot of consults require counseling. Okay. Yes, the challenge in those days used to be prescribing if it was required, but otherwise, psychiatrists could consult with their patients using a simple webcam and a microphone. Obviously, in those days there were no security standards, and nobody thought about those compliances, but it was still happening. Today, if you look at it, it has opened up a huge number of opportunities across the different areas of patient care. Okay, and I won't just restrict it to patient care. And also would like to include wellness, because that's in the definition of healthcare as per the WHO. So if we look at, if we take it from the beginning, and start with, let's say, wellness. If you look at a lot of fitness companies have started, whether it's Fitbit or whether it's Garmin, they started off with their watches and devices that measure basic things. From a hardcore clinical perspective, in my opinion, I do not see any value in that. But from a wellness perspective, it holds value to a certain extent. And what they have done is that over and above that, through the use of mobile applications, they have improved upon the wellness aspect for that in terms of telehealth. The second thing I would like to come to is preventive care, where it is used in, and when I talk about preventive care, I include care that, or prevention of care, as well as patients who are suffering from what I would say is chronic diseases, the usual suspects being diabetes, hypertension. And nowadays there are lots of applications as well as IoT devices that cater to home monitoring. So for example, glucometers, for example, blood pressure monitoring instruments. Okay, technology being technology, of course there is a degree of plus minus in terms of the accuracy of the readings, but I think with technology we will be able to plug that gap over a period of time to make them as accurate as the good old, let's say, dipsticks that were used for glucose monitoring, or the good old mercury sphygmanometers that were also used. That's just a matter of time as technology itself progresses. And then, of course, we come to healthcare provision itself, which I would say I divide into two areas. One is of primary healthcare, which is at the primary care level, and the second is at the specialist or the tertiary healthcare at that level. Wherein, when we talk about primary care, we talk about your basic access to healthcare. So it could be at a rural level, wherein you provide basic health care for people and patients, or it could be various different specialties that which have been around. I mentioned one, telepsychiatry. There are lots of others. For example, I'm involved in teleradiology at the moment. There are others, telecardiology, teledermatology, and again, with the increase in technology, it is just a matter of time when this will start expanding to other specialties as well. I will say this: it will take a little longer for specialties such as, let's say, surgical specialties, where you can do part teleconsult, but then if the patient has to come in for a procedure, then there is no choice but to call them in and do it manually. But then again, having said that, I think it's just a matter of time where robotics will take over. It's already started, and the good thing about that is that it will help. Technology in that sphere will help in improving patient outcomes, improving patient safety, and reducing patient accidents or incidences that could possibly happen because of human error. But having said all of this, I think the guidelines that the government came out with recently in telemedicine have really, it's really been an excellent start, because in my personal experience, when I've talked to clinicians and friends and colleagues in the clinical fraternity, they knew telemedicine is there, but they were not sure how to use it. They were not aware of what they could do or what they couldn't do. Some doctors talked about doing consults over WhatsApp, which I said from a medico-legal perspective is not safe, but they were still doing it. Okay, so I think that with the coming out of the guidelines, it has really defined the parameters in which clinicians can practice, and also, well, they call them registered medical practitioners or RMPs as per the guidelines, and healthcare givers and healthcare providers. In addition to that, I think another good thing that it has opened up in terms of virtual care is that over the last several years, a lot of state governments have been toying with the idea of implementing telemedicine, but they were not sure how. Now, with the one or two states have done it. One example is UP. They have implemented telemedicine on a large scale before the guidelines were released. But now I think this gives an impetus to other states to, now take the bull by the horns, because they have got guidelines and they've got a better understanding to actually go forward and implement it in their respective states. So it's given state governments a lot of clarity. The other thing I appreciate about virtual care is that it has now partially solved an age-old problem that has been dogging healthcare provision, which is access to care. With the advent of complete telemedicine solutions, which include not just the video conferencing, but also the EMR, or the electronic medical record aspect, as well as the IoT, or the information of technology devices. This has now opened a new whole area for provision of healthcare nearer to the patients, and has partially, I won't say fully, but has partially solved the access to healthcare issue, which has been a problem for providers in the past. Another good thing that virtual care has done in terms of the implementation of the guidelines is it has also now clarified to clinicians and RMPs what tools they can use. Okay, as I just stated, a lot of doctors prior to the guidelines being implemented on virtual care have been using WhatsApp. Not a good thing to use. There are a lot of doctor groups out there that share radiology images and lab reports on WhatsApp. Again, WhatsApp may say that they're encrypted end to end, but then let's be honest, who owns WhatsApp? It's owned by Facebook, and they have access to all the data. Okay, we do not know what they do in the background, but after seeing what has happened in the past with Cambridge Analytica, for example, I have been telling my friends and colleagues, clinicians, to avoid it, but because of convenience and because the patients want it, they are still using it. But it is also, the guidelines have also provided that, look, there are other, tools out there apart from WhatsApp that can be used. So, for example, if we look at Zoom, again, that also has come into question in the past. But they, for example, for the US, they have got HIPAA certified servers for their video conferencing, specifically for healthcare providers. So I think that all these things put together, the telemedicine guidelines, what we have today, may not be perfect, but at least it's an excellent start, and it gives some idea and some guideline, on the path that healthcare providers, whether they're private or government, can take to start implementing telemedicine services and virtual care in a big way.
Thanks, Doctor. Girish, I know you've been waiting to go, but then I have one quick question to Dr. Vivek, and then I come back to you, and then we, after that, go to the audience questions. So, Dr. Vivek, quick question to you. All these newer things which are happening, what's your take when it comes to, let's say, tele-ER or tele-triage services?
Okay. Again, a very important area. I would say that's quite a critical area. Again, what it boils down to is the patient, being patient-centric at the end of the day. If we look at the announcement made by the Prime Minister on the 15th of August, The aim is to create, ultimately, it's not just about have every citizen in India having a unique patient ID. It also goes to the next level of creating a longitudinal medical record for each citizen in the country. Okay. Now, in order to achieve that, um, what is need to be ensured is that for the completion of the record for continuum of care, and as what Bharat mentioned earlier, the outcomes of care, what needs to be ensured is that we have the data from all the different sources. Okay, today they may be going to a government hospital for an outpatient consultation. Tomorrow they may go to a private provider for an inpatient admission or a procedure. Okay, now or let me take it another step further. There may be a case where they have to they are on an outpatient, let's say a pregnant lady who is in a C-class town and is using let's say a telemedicine service. Okay, what is critical here is that irrespective of which provider and which service the patient is availing of, the complete patient record needs to be available to all the providers to ensure care is given to that patient and the outcomes are achieved. And for that, the golden word is, which we are all very well aware of, is interoperability. Okay, I'd like to just cite two examples here in terms of that, in terms of the things that I've just said. Let's take the case I just spoke about, a pregnant lady who is in a, let's say, in a village area. Let's say she's about in the second trimester, and she has developed eclampsia, and she also happens to have gestational diabetes as well. Okay, now in this case, when she goes for a, let's say she can't go to the nearest district hospital for a checkup, so she goes to the the telemedicine provider, nearest one available to her. That RMP who is providing the care needs to make sure that they are able to have all the patient details, which is on one medical record as of that point. At the same time, they have to ensure that they are able to link up with the three specialists, that is the OBGYN, the cardiologist, and the endocrinologist. They also need to ensure, the system also needs to ensure that all these three people, the specialists sitting at their hospitals, also have the access to that same EMR and patient data when they are consulting the patient online during a telemedicine consult. And that pulling that data from various sources is the key, which is what I said of interoperability. And that is why at the time of triage, data to ensure patient care and ensure the quality of outcomes for that patient is required at the time of triage. A second example I'd like to quickly give is with regards to trauma. Suppose there is an accident, off the highway. The patient is taken to the nearest PHC, which has a telemedicine facility. The RMP at that site should be able to connect with a trauma specialist or an emergency unit at the nearest tertiary hospital online. They should be able to connect to an orthopedic surgeon. They should be able to connect to a surgeon, maybe even a spine specialist at the same time, because it might take time to shift the patient. The patient could be very critical, and if they're able to link, and if these specialists are able to simultaneously see what has happened to the patient, then they can at least stabilize the patient, and the patient can then be shifted to the nearest tertiary center for treatment. So this is why I feel that provision of tele-triage is critical at the point of care, and to ensure clinical outcomes and for the good clinical and desired outcomes for patient care, it is critical that triage is done correctly and all the data is available to all the healthcare providers, simultaneously if possible. That would be the gold standard.
Very clearly explained, Dr. Vivek. Thank you so much. Girish, yep. got a couple of questions for you before we go to the audience. As a provider, how have you seen and how much of these technologies have you been able to embrace and bring in into your own organization with the advent of this pandemic? And from the time, how have things changed for you as a technologist, for a provider, and all your customers, which is your healthcare workers inside your system? What changes have happened and how have you seen this happen?
Yeah. The first change, which is very good from the IT perspective or the CIO perspective, is IT is also seen as a revenue generator. IT was always a service provider, but this pandemic has changed the perception now because IT has been a savior. We are able to generate business. So that is the first perspective change. IT can also bring revenue. Second is uh, from the hospital point of view, yes, because of this pandemic, we had to start somewhere. So start small, start with teleconsultation. We started with teleconsultation, video consultation. And the third thing is patients, as Dr. Vivek was mentioning, patients are also aware now care can be available through technology, right? The example which I would like to quote here is we have started this home quarantine facility where for this pandemic patients, they need not come to the hospital if they're asymptomatic. So this we have started using technology where the hospital is also benefiting. We are not losing customer patients. The patients are at the comfort of their home. They are asked to have some devices like your SpO2, and they have to just read out the readings and mention it. So this engagement, patient engagement is very big thing which has really happened, and that is good for the entire community. So we had to start somewhere. It will obviously evolve and stabilize at a point of time. It was always there. Technology was not tested, so it will take some time, but at least we started exploring. Yes, as Dr. Bharat was also mentioning, there are privacy challenges, there are security challenges, but hopefully that will be taken over, because one more thing is from the patient's perspective. Now patients are also comfortable to have a video consult, which they were not. Initially patients were very rigid to come and see doctor in person. They wanted a physical consultation. Now with this pandemic, with the fear of travel, that is one, and second is there are a lot of patients who are not mobile. For them this is really become a boon. So the next logical step from the provider point of view is leverage on this, and something called home care, where patients have started demanding, and now that they know that care can be given through technology, they can always start home care facilities where at the comfort of their home there will be a consultation, the doctor on other side. And secondly, we do have hospitals in tier 2 cities. We can always start a satellite clinics where the rural population can be tapped. So these are the initiatives what we are planning this in the pipeline.
So, Girish, as a follow-up to your response, you know, what is it that you would want to share as your thoughts, your advice to the healthcare providers in India, maybe the small and medium-sized health providers in India, as to what their telemedicine strategy should be and what should be the sort of timelines that they should give to themselves to make this happen and then show outcomes for them?
Telemedicine is again a journey. So as I mentioned in my first comment, you need to start with a teleconsultation and a video consultation, because telemedicine was there. There's a cost associated with it. So if you're talking about mid-size hospitals, with the current pandemic, revenues are a bit of a problem. So you may not have that much of a capex to start with telemedicine. You can't leapfrog directly from zero to telemedicine. What I would suggest is you start with teleconsultation, have your processes in place, start engaging the customers. Once you have engaged the customers, there are a lot of tools like CRMs and all available where you can know who are your customers. Then once your processes are in place, have a core committee which comprises of your operations, your clinicians, who will form a team. First buy in the stakeholders, your hospital stakeholders, then start uh, having devices integrated one by one, and then go to this thing. Once that is stabilized, have a maybe a teleradiology or a tele ICU, depends on what your strength is, depending what your hospital is your main specialty business model. So based on that, you have a choice, because telemedicine, again, it's a very broad term. In telemedicine, you can have a tele radiology, tele ICU, telecardiology. So you can depend on that, and that is one. And secondly, also you can have a primary health center set up, because once you have the process in states, if you have hospitals in say tier 2, tier 3 cities, there is a lot of rural population who are find it difficult to travel, or they have some limitations, they are not mobile, they are bedridden. So for all these, you can tap these patients, so this would be. And look at a time frame of say 6 months to progress from your teleconsult to your telemedicine. That would be the time frame. So in that, you also identify a good partner, because for all this you need a good partner who can design the application based on needs. Because in this particular industry, having a good partner is difficult, because every hospital has a different process. So one partner, if he has a flavor, he will have a vanilla flavor. So how do you have that application customized to your processes? That is very important. So having a right partner who can have on a SaaS model, in this thing would be a good option, according to me.
Thanks, Girish. Thanks, pretty insightful. I think we will possibly look at a couple of audience questions. I'm not too sure how many are there. Just give me a minute. I'm opening my window, and yeah, there are about 4 or 5. But let me just probably pick up a few very relevant ones for our discussion. Just a second. Please be online. I'm just trying to read through all the questions, and yep. I mean, any one of you or all of you can give me your take on this. But one of the question is, sir, what is I'm reading it quote and unquote. So, what are the business models of telehealth platforms? Is it digital only? Is it digital first? Or do you suggest a hybrid model? Some of the thoughts already come from Girish in his previous statement, but then I would want others also to take provide their opinion on this, and Girish can also do it. Yours, gentlemen.
Yeah, I'll take this one. The way I see it is that, we're talking about telemedicine as a catch-all term, but everybody sees the elephant differently depending on where they're, which part they're holding, which which really means that there are going to be different interpretations of how to go about it. And the entire ecosystem is going to be disrupted. Now, who's going to be able to get more traction out of this change? Is it going to be people who come in, like you said, with a digital only model? I mean, they don't have any hospital, they don't have any facilities, they just bring like Uber drivers, they bring the doctors on board. And then you have people who are doing digital first, but they have facilities or the ability to provide a home care service. They have the physical part as well. And then lastly, you have the ones who have largely physical services and the capabilities, but they also enable themselves to become digital. Now, which of these business models will get more benefit out of this change? The first look, it seems like the digital only guys will benefit, because they will acquire a lot of customers and they will be able to capture attention, and their abilities to do this will be higher in terms of the experience they provide. But healthcare is largely about the physical service at the end of the day, because even after a triage is done or a consultation is done, if there's a follow-up investigation or there's a follow-up consultation, you will still have to go to a physical facility. So my take is that there will be a new class of providers, and I don't think they will be purely physical, and they'll not be purely digital either. So I would bet on the guys who are digital first and back it up with a solid physical service at home.
So,
Thanks,
Bharat, I
Bharat.
would like to add to this. You are right. It has to be a hybrid model. See, because what we were thinking is like for consultation, when the obviously when the patient walks into the hospital, there is a follow-up consultation. So we were planning to have this follow-up consultation where already a rapport has been established with the doctor, and the follow-up consultation, the doctor must have advised some tests or some investigation and come up with a report. So the follow-up consultation would be an ideal hybrid model where for the first consultation, the doctor has seen the patient and he just has a follow-up consultation, which can be done over the phone. So such type of a hybrid model is.
Yeah. My view is that I agree with both Girish and Bharat on this. Simply because of the way medicine is taught and practiced. You know, um, ever since practice of medicine has started, it has always been a physical event or a physical um, thing where a doctor does need to evaluate certain signs and symptoms based on a physical touch or a examination. Okay. However, having said that, I think if healthcare providers are able to become what I would call integrated healthcare providers and provide whatever model or part of that model that can be done technically, and then the rest be done manually. I think that is what is going to be a successful model going forward. And I've also strongly always believed that, contrary to what patients think, that the doctor is responsible for their healthcare. Well, in my opinion, I'm sorry, they're not. The patient themselves are responsible for their wellness and healthcare. And the doctor is only the person who will treat them. And it is time that patients started taking responsibility for their wellness and healthcare. And it has started. There's no doubt about it. It has started, which is a good thing. And it's only a matter of time where it will, continue.
Thank you so much. Appreciate. Two very, very last specific pointed questions. If this, when I say this as in telemedicine and the initiatives, is going to be a bubble to burst, will it still carry the same euphoria and the momentum once the pandemic gets downgraded to endemic, maybe in the next couple of months or the next year? What happens to all that we've spoken, all that we've seen happening in the last 6 months in terms of moving out virtually to where the patient is than getting the patient to come where you are? Your
Right.
take, gentlemen.
So let's look at the geographies where some amount of opening up has already happened. What the news has been filtering in is that post the pandemic, during the pandemic phase in those countries, the telemedicine went up from like 2%, 3% to sub 10% to about 60%, right up to 90% in some of the countries. Post the opening up of the healthcare facilities, they dropped down considerably, from say 90 to 60 and from 60 to 40, but they never went back to 3%. And they probably will never go back to 3%, because once the doctor and the patient have tasted the success of telemedicine, like I'll just quote a personal example. I know somebody who was able to get a diagnosis of zoster online. This person is going to continue to use it, and so is the doctor who's done the diagnosis and given the prescription, because they know it worked. So similarly, they're going to be a good percentage. My bet is 15-20% even after the pandemic will continue, which is a big jump from what it was.
Yep,
To
very
add
true.
one more perspective is there will be a decline. We will not have the same percentage what we see here. If, for a hypothetical 60, it won't be 60 post pandemic. That is very obvious. But it is up to the management. It should be a top down approach. Like, okay, now during this pandemic, we have set this process and you need to follow this. Because there will be some players who are forced to adopt this technology, even though they were not willing. Now they see, array, everything is back to normal. We can go back. We will not do. So it has to be a more of a top-down approach where the management has to influence it, because we had this long conversation of adoption of technology. Now that is taken care. We have to hold on to it. If we don't hold on to it, then it's going to be disaster. So the management top-down approach is very vital.
Thanks, Girish.
Okay, I'd like to take three perspectives. Okay, first I'll take the patient perspective. Even if the pandemic, starts to stabilize, vaccine comes out whenever it does, a cure comes out whenever it does. Psychologically, the patient will feel that fear is still in the back of their minds. So if they're given a choice that A, would you like to come in and see the doctor, and or B, would you like to have an online consult? That will be a patient's choice, which will dictate the increase or decline from a patient perspective. So that's one thing. Second thing is from a provider perspective. When patients start coming back to hospitals and things come back to normal, I think Girish can comment on this a bit better, but it'll then come up, it'll then be as he said, it's up to the management what they want to do. Do they find that they can save costs doing teleconsults while still charging the same consultation fees, whether the patient comes into the clinic or they do it online, is entirely up to them. So that would be a management call. And secondly, will they be able to scale up or maintain that level of technology to keep supporting telemedicine and teleconsults that are happening? And then the third thing I would look from a clinician's perspective, which is I have friends who are GPs who have actually said, you know what, please let us know where we can get the telemedicine training from, because we would like to stick with this going forward. We would not like to go back to our clinics, and we find that our patients are also comfortable with this. Okay, so from a clinician's perspective, again, I would say I look at it as specialty specific. Maybe people in certain, well, of course, where surgical specialties are concerned, definitely patients will have to come in. In case of they have to be examined by a surgeon and perhaps have to undergo a procedure. But on the other hand, if we talk about primary care as an example, and maybe certain specialties of tertiary care, if patients are comfortable, then doctors might just go back and say that, okay, let us continue with teleconsults if that's convenient and for us and the patients. In an overall perspective, I just like to add one thing. Psychologists say that it just takes 21 days to change a habit. We are now almost 4 months or 5 months into the pandemic, and habits have definitely changed. Now, will they change back? Remains to be
Another
seen.
21 days.
Well, let's see. Let's see how it goes.
Yeah. Okay. My last question to each one of you. I've got a couple of people who've been asking for this. 2-3 of them have asked, where can we actually find a comparative between platforms which we should look at adoption from a telemedicine, teleconsult perspective? Now, I'm asking this question to all of you because I know you've been involved in setting up of the telemedicine registry, and a lot of effort, a lot of time spent on evaluating platforms, products, classifying them. So where do you think as a delegate or an audience, somebody wants to start their telemedicine, teleconsult journey, what is it that they need to look at, and where can they get more information about all the platforms and the providers there? Bharat, you want to take that?
Yeah, sure. So when we started the Telemed registry, the objective was to do exactly what you're saying, give the healthcare providers a choice of platforms that they could use to deliver safe, secure, and comprehensive telemedicine. What we have been able to do now is at least get them a choice to go to this website and see what all is available. So you go to the website, you can see under each category what are the choices of platforms. And over that, we have evaluated these platforms. Dr. Vivek and Girish both have been members of these evaluation panels, where we have evaluated these platforms and scored them in the expert panel's views of where they stand in terms of compliance and standards, where they stand in terms of the experience that they give to the doctor and the patient, and the convenience of flexibility of the processes. So this would be a good place to start. You can choose the category you want to look at, like tele-ICU or teleconsultation or remote patient monitoring, or even specialized services. These are the 4 categories. Under those categories, you can look at who's available, and the ones that are evaluated, you can get a detailed report on it. Other than that, we also have a preliminary report which guides you on the roadmap to go in the journey, and starts with the telemedicine part of it, telehealth, and then the virtual care. So I think Girish and Dr. Vivek can explain what we have been doing in the evaluation in the telemed registry.
No, I think let the users go across and then visit the site and then start taking information, and then they can reach any one of you if they want specific help in terms of guidance, how to go about devise their own strategies and stuff like that. We could always do that. Sorry, Bharat, I had to stop this because probably running out of time. I will not be able to take any further audience questions at this point of time. So I'm closing that. But before we wind up, a few of my thoughts here. The first and foremost thing is you guys have been able to articulate this in greater detail, that telemedicine is not equal to teleconsult. Teleconsult is a part of the telemedicine ecosystem, and that's the most fundamental thing. So I don't want people to get confused about it, and that's the reason I'm reiterating on this. This has come out pretty evident and strongly here. The second thing is this has actually, as I said initially, opened the Pandora's box, but then this is also solved, and as Dr. Vivek said, an age-old issue of access to care. I think we've now been able to reach out a few times more number of patients than what we could have actually achieved and then cater to, right? So that is something which is a very, very important outcome of how this has actually helped both the provider and most importantly the patient community. Okay. Then the next thing which I would want to say is from an approach perspective, and again we've seen great articulation on that. No point in having the big bang approach here. Take small steps, take informed decisions, and move towards those outcomes which you think are achievable. Achievable not just in terms of deploying and saying, hey, I've achieved this. Achievable from a perspective of defining the do's and don'ts for every one of the elements, be it the service provider or the recipient of these services. So you have to define your do's and don'ts very clearly, set your processes in place to make sure everybody understands what the borders are or the boundaries are. The second thing is make sure that all the care providers are trained and enabled to deliver services as per the defined do's and don'ts, which is another very, very important thing here. Then we come to the question of data privacy, which is a separate subject. A lot of work happening around data privacy, both at the state and the central government levels. Guys have been privy and a party to it. All of us have been knowing about it, but that's a separate subject, which I don't want to dwell at this point of time into. Privacy and security is paramount and sacrosanct, cannot be compromised. So we got to make sure that we are fully testing this entire platform end to end before anything is rolled out. Okay, and another important aspect which did come out from completing this loop is in terms of the consent framework, where there is a lot to be done. I personally opine that we still have miles to go on this, because it's not complete, it's not comprehensive. There are gaps, there are issues, but I'm sure as we go along, as we come across different use cases every day, we are going through the process of hardening our own processes and SOPs to make sure that we don't hit the same situation time and again, right? Now, having done all this, where are we moving towards? Okay, where are we moving towards is something which clearly comes out, which says tech as a savior. That's a very, very powerful statement Girish made, and I completely agree with you on that, Girish. No two ways about it. We have had our challenges, we've had our share of problems in a situation where revenues have shrunk to about 10 maybe single digits for performing hospitals and providers. It has been extremely difficult to pull out additional budgets for these kind of initiatives, but then with all those limitations, I think as a community we've stood together, stood up and said, hey, look, I will deliver this for you. And that's a fantastic effort from each one of you who've been doing this day in and day out for the last couple of months. So tech as a savior has changed the outreach process, has changed the way we've gone to our patients, has changed the way we engage and interact with our patients, right? So that is a very, very important thing which we need to keep in mind. Now, what does this actually mean from us? Borrowing a few lines here. Are we moving from illness to wellness? The answer is yes. Are we moving from reactive to proactive care? The answer is yes. Are we moving from are we moving from reactive to preventive care? Yes, we are moving towards preventive care. So that is something which we've seen clearly happening. So what has happened is wellness, proactive, and preventive care are the three solid mantras which has emerged out of this tough situation for all of us. And telemedicine has been the vehicle and the platform for us to deliver this both to our own organization and to our patients, right? After all this, we still have to live with the great Indian jugaad. Thanks, Dr. Vivek. The WhatsApp of this world, the other internet messenger tools will still be in existence. We really don't have a choice. We have to live with them. But then, as much as we can, we need to educate our fellow care providers that this is something which is not acceptable, particularly once you have the privacy laws and all that becoming an act and getting enforced. I don't think we can even think of doing those things what we've been doing today. But then you really can't stop it, right? We will have to make a conscious effort to mitigate it as much as possible. So the point is we've come a long way. We've made tremendous strides on this. We've seen ourselves as health technologists that the last 6 months of action probably is much larger, much faster than what we probably would have seen for the last 1-2 decades we've been associated with this industry. That's the way, that's the pace at which we've been able to see this change happen, and this change is now going to be the constant. But still, the loop is not open, and we have miles and miles and miles to go. And I think together, all of us, we should be able to overcome this very soon. Thank you so much.
Thank you.
Thanks to Anuj and team from the Seekso TV for giving us this opportunity and then putting our thoughts in. I'm sure you will have all your delegates and audience being immensely benefited. And please feel free to reach out to any of us for any specific doubts, clarifications, or a discussion or a debate on this subject. Now, a last disclaimer here. These are all our personal opinion, personal views, and these are not mandated to be accepted and absorbed by anybody who's hearing us out. Thank you so much. Appreciate it.
That's an interesting piece of discussion. Many thanks to the learned panelists. Moving forward, we at Health Technology congratulate the country's best medical technology ecosystem Andhra Pradesh MedTech Zone, that is AMTZ. Under the leadership of Dr. Jitendra Sharma, AMTZ has produced advanced IVD products, ventilators, dialysis machines, and digital mammography systems. AMTZ is the country's first initiative to lead the country towards independence from imports by being a torchbearer of Make in India initiatives in medical devices space. Let's watch a small AV from AMTZ. Thank you.
For more updates from CXO TV, please like and subscribe to our channel.